Hello friends, welcome to Medical Guruji. Today we will discuss the diagnosis of mental retardation, also referred as intellectual disability. So there are various tests to diagnose the mental retardation. First we will discuss the intelligence tests. In the intelligence test there are various scales. First one is Stanford Binet Intelligence Scale. This test measures a wide range of cognitive abilities including verbal reasoning, visual spatial skills, and memory. It is often used measures cognitive abilities in individuals aged from 2 years to 85 plus. The content areas include fluid reasoning, that is ability to solve novel problems and think abstractly. Second content area is knowledge, accumulated knowledge and information. Third is quantitative reasoning, that is by giving mathematical and numerical problem to solve them. Fourth is visual spatial processing, that is to understand and manipulate the visual information. Fifth is working memory, holding and processing information in the mind. Then we administer together all and score, provide an overall IQ score and subscore for each content area. There are steps in administrating the Stanford Binet scale. First, you have to establish rapport with the individual. Secondly, you have to present the task. Ask to do some task from the individual. That is verbal task by giving vocabulary or comprehension, by giving non-verbal tasks such as visual puzzles or block designs. Observe and record the responses. Score the responses according to standardized criteria and calculate the scores. Raw scores are converted to standard score, which are compared to norms for the individual age group. Second scale is Wechsler Intelligence Scales. This series of tests include different versions of various age groups. First is for Wechsler Preschool and Primary Scale for Intelligence, WPPSI. This is for children aged from 2 years 6 months to 7 years 7 months. Wechsler's Intelligence Scale for Children, WISC. This is for children and adolescents ages from 6 year to 16 year. Third one is Wechsler Adult Intelligence Scale, WAIS. This is for adults ages from 16 years and older. These tests provide an overall IQ score as well as subscores in different cognitive areas. This scale was developed by David Wechsler. These scales provide comprehensive assessment of intellectual functioning, yielding valuable insights into an individual cognitive strength and weakness. As there are different versions of the Wechsler scales, content areas and subtests are common. So each Wechsler scale consists of various subsets that assess different cognitive domains. These subsets are grouped into composite scores, providing a comprehensive profile of an individual cognitive strengths and weaknesses. The specific subtest and composite scores may vary across different versions of the Wechsler scales. Common content area and subtest includes verbal comprehension. This area assesses verbal reasoning, comprehension, and knowledge. Its subtest may include vocabulary like define some word, similarities like identify the common things between two concepts, comprehension like understanding and explaining the social situations or the rules. Then second area is perceptual reasoning. This area evaluates the visual spatial skills, non-verbal problem solving, and fluid reasoning. Its subtest may include block design, that is by recreating visual patterns with blocks, matrix reasoning, completing visual patterns, visual puzzles, assembling puzzle pieces to form a complete image. Working memory, this area measures the ability to hold and manipulate the information in mind. The subsets of working memory include digit span, that is repeating sequence of numbers forward and backward, arithmetic, that is solving mental math problems. Next area is processing speed. This area assesses the speed and efficiency of mental processing. Subtest of the processing speed include symbol search, like identify target symbols in a larger set of symbols. Then coding, matching symbols to numbers according to a key. Then these subsets and areas are administered and scored. Wechsler scales are administered individually by trained examiner following standardized procedures. The examiner present a variety of tasks, observe and record the individual response, and the score them based on the standardized criteria. Raw scores are then converted into standardized score which are compared to norms as per the age of individual. Then the results are interpreted. Wechsler scales provide a full-scale IQ, FSIQ, representing an individual's overall cognitive ability. Additionally, composite scores for each content area offer insights into specific cognitive strengths and weaknesses. These scores are interpreted in context of the individual background, developmental history, and other relevant information. Clinical application of Wechsler scales are widely used in educational clinical research settings. They assist in identifying the intellectual disability, diagnosing the learning disabilities, assessing cognitive strength and weaknesses, evaluating the impact of neurological condition or injuries, guiding educational and intervention planning. There are some key considerations like Wechsler scales should only be administered and interpreted by qualified professionals with expertise in psychological testing. Strict adherence to standardized procedures is crucial for accurate and reliable results. Examiners should be mindful of cultural and linguistic factors that may influence the test performance. Wechsler scales are typically used as a part of comprehensive assessment, including gathering information about the individual developmental history, medical background, and educational experiences. Second test to diagnose the mental retardation is by adaptive behavioral scales, that is Vineland adaptive behavior scales. This assessment evaluates an individual ability to perform daily living skills and meet the demands of their environment. It covers areas such as communication, daily living skills like dressing, eating, socialization, and motor skills. Detailed developmental history is gathered about the individual, developmental milestone, medical history, and any significant life event. Observing the individual's behavior and interaction in various environments such as at home, at school, during play, during alone, etc. Then insights are obtained from the individual parents and the caregivers. Additional assessment should be done like medical examination to rule out any underlying medical condition that may be contributing to intellectual disability. Genetic testing. If a genetic disorder is suspected, genetic test can be performed to identify the specific genetic abnormality. And neuroimaging, in some cases where brain scans can be used to identify structural and functional brain abnormalities. These were the different tests for diagnosing the mental retardation or intellectual disability. If you like the video, then share and subscribe to Medical Guruji for more information. Thank you.